Hey, it's Dr. Toby, physical therapist for Rehab Mobile. Thank you for coming to the Rehab Mobile channel to check out our site. I want to share with you in this video how to know if a knee brace is going to help you with your knee pain. By the way, if you are new to our channel, subscribe to our channel by hitting that red notification button, and you can get up to date on all the videos we release because we make videos on how to stay healthy, pain-free, fit, and mobile. All right, so I want to talk with you about how to actually know if a knee brace is going to be effective or not effective for helping you with your knee pain. And this is a really big question I've been asked by hundreds of patients, and they're always trying to figure out, oh, should I be wearing a brace? Should I not? And the general principle I'm going to tell you or teach you today is going to be helpful for other scenarios in which wearing a brace may be in question. Now, the best way to understand if you should be wearing a brace is to talk to your healthcare provider. Now, we have a link in our description, the Talk to a PT First button. Click that and we'll give you some information specifically on your situation. The best way to know if you should be wearing a knee brace and if it's really gonna help you or if it's actually hindering you is to talk to somebody so that they can know exactly what your scenario and your situation is, because every situation and scenario can be different. So we have our expert team of physical therapists who are all doctors who can tell you exactly what you should be doing, when and where, and why to be wearing a brace and at what time, things of that nature. So that's the caveat I want to give you. This is for educational purposes. And so one of the things that you want to realize when it comes to wearing a brace is that, number one, a brace oftentimes is meant to stabilize. And so if you maybe just had a surgery, if you maybe had a traumatic accident like a car accident, then those are scenarios where you definitely most likely are going to want to be wearing a brace, and your healthcare provider should be talking to you about those things. Now, I know in this generation, a lot of times people are very accustomed to having certain incidents happen, accidents, and they wait a long time before they go to see the healthcare provider, before they go to Patient First or wherever they go. And so if you are having lots of pain and discomfort, severe pain is one of the indications that, hey, a brace can be a temporary support to reduce that pain, but also to stabilize anything that might feel like it's loose or like it's torn or dislocated, things of that nature. You can have a dislocated kneecap, or other parts of your body can be unstable, maybe like when you're going down a step or going up a step. And those are scenarios where braces can be very, very critical to helping you, number one, prevent things from getting worse. Now, what I want to talk about is the other side of the spectrum, because there are a lot of people who wear knee braces as a solution to knee issues, or almost to kind of put a band-aid over a severe wound, right? So in situations where you've had chronic knee pain, and maybe you're somebody who wants to exercise, or you want to pretty much go for long walks or do certain things, wearing a knee brace is not a solution or a fix to the problem that you actually have. So you don't want to wear a knee brace as a crutch or become dependent on it, because one of the reasons why people make their knee pain worse is actually by wearing a knee brace for too long, or when they don't need to be. Because what's going to happen is the muscles that are actually supposed to stabilize your knee are going to eventually get weaker. So if you're somebody who's like, well, I can only exercise or do squats when I wear a knee brace, that may be beneficial and can be good in the temporary, but if you want to use that as a solution, you're ultimately going to run into a challenge where your knee is going to become weaker in certain aspects. And so wearing a knee brace is not a substitute for getting injuries fixed or corrected with physical therapy treatment. So just to give you a quick example, here what we have is a knee diagram, and what it simply is showing is a basic concept of the muscle structure, right? You have one of your central muscles. This is one of the quadricep muscles, your rectus femoris, and you have these ligaments here, you have ligaments here and inside your knee, and all of these are working to provide some protection and stability to your knee. Of course, there are some other muscles that surround this, but what happens is when these muscles are used to being on vacation because you're wearing a knee brace and you're relying on it, these muscles are going to get weaker and provide less stability to your knee. And that's going to lead to, more likely, when you're not wearing a knee brace, like going down the steps or doing something, that may lead to more pain or discomfort or injury in those scenarios. So when to wear a knee brace, in summary: wear it when you have severe and intense pain that needs to be stabilized and be reduced. When you've had traumatic injuries, whether an injury like a car accident or you've had trauma due to like a surgical procedure, wearing a knee brace is going to be helpful in those scenarios. But it becomes a hindrance when you're relying on it. If you're like, hey, I can't do this exercise unless I'm wearing a knee brace, then that means you probably need to talk to a PT first. You probably need to have a conversation, get it examined. We do knee pain diagnostics that help people to understand not only what's going on with their knee, but why it got that way and how, and what to do to avoid it getting worse and how to really fix it. So that's really going to be an ideal approach to somebody who wants to be physically active again, who wants to get back into running. Some people have been told that they're never going to be able to run again by their healthcare provider, but we've taught so many of our patients that that's not the true, and it doesn't have to be the case. So if you are somebody who has been relying or being overly dependent on a knee brace, you want to talk to a PT first, get an exam, get it figured out exactly what's going on, so that you're not just kind of slapping a band-aid on a broken bone or something like that. So hopefully that gives you a good idea. Hopefully you found this video helpful. If you did, leave a comment and let us know what you found helpful. If you have other questions, go ahead and don't hesitate to leave that as a comment as well. Like this video and share it with somebody. And again, don't forget to subscribe to our channel, because we want to help you stay healthy, pain-free, fit, and mobile. All right. So again, hit that link in the description if you are looking for some more answers. It takes like 30 seconds or less, and it's 100% free. We'll give you some helpful information, and the most helpful information we can give you is based on your specific scenario. So go ahead and fill that link out. All right, talk to you soon and take care. See you at the next video.